Diogenes syndrome is not a specific disease, but it is a condition characterised by excessive hoarding of rubbish, apathy, social isolation, and neglect of one's personal care and living in squalor. A person with Diogenes syndrome lacks embarrassment about the squalor that they live in and their unkempt physical appearance, and do not think they need help. Diogenes syndrome is named after the Greek philosopher Diogenes, who lived in the 4th century BC. He lived in squalor in a large clay jar in Athens. However, unlike people with Diogenes syndrome, he lived free from possessions and did not socially isolate, but enjoyed social interaction. Diogenes syndrome may be primary, where there is no mental or cognitive impairment sufficient to explain the symptoms, in which case it's usually found in the elderly, or it may be secondary and appear in conditions such as schizophrenia, bipolar disorder, obsessive compulsive disorder, depression and dementia. It is also found in people who are addicted to substances, especially alcohol. It is thought that in some cases Diogenes syndrome is a response to trauma late in life, such as death of a spouse. Scientists and clinicians do not completely understand the condition Diogenes syndrome. However, it is thought that there may be some impairment in the frontal lobes of people who present with this disorder. It's important to intervene early, where people then may be amenable to receiving help. However, as it usually occurs in people who live alone and they become socially isolated, the condition may not come to attention unless there are conflicts with neighbours over odours or pests, or there are risk of falls due to the clutter in somebody's property, or fires, or physical illnesses like pneumonia.